Hello, bariatric care friends, and welcome to a new episode of the podcast. And it's a fun new episode for me because I've never had our guest on the show before. And she is amazing, and you're going to find out some really important information from her because so many people are looking for a bariatric therapist. And this woman, Ashlyn, has started a program, and it is online where you can actually find a bariatric therapist. So I am welcoming Douglass Barnes, Ashlyn Douglass Barnes,
You got
and
it.
she is the founder of Find a Bariatric Therapist. But she is much more than that. So we're going to start with the much more than that part. Hi, Ashlyn.
Hello. Thank you so much for having me. I'm so excited
Well, it's
to be
about
here.
dang time, right?
I know. We've been talking about this for a while.
Sheesh. And we met last December, and we had Ashlyn came to the Berry Merry Christmas event, and we had lots of time to chat. And I was like, wow, this woman is bright. She knows what she's doing. You actually educated me about a lot of things, and it was great just to get your insight and input to some of the things that we deal with specifically as bariatric therapists. But you are also a bariatric patient. So let's start with your personal journey.
Yes. So I had bariatric surgery now over almost 12 years now. So June will be 12 years. So feels like quite a long time in some ways and not in others. I was just beginning my therapy career at the time and never thought I would find kind of myself being a bariatric therapist because, what do I know? I'm just trying to figure this part out too. So it's been kind of a journey for me as well. But essentially how I ended up with bariatric surgery is I randomly became anaphylactically allergic to metformin. Very
Mhm.
rare. I had been on it for a while. I didn't believe it was true, so I took myself off of it and then I put myself back on it. Don't do that if you're anaphylactically allergic to things, by the way.
Mm.
It can cause really bad, reactions. So we confirmed that that was true. I went
Wow.
and saw a bunch of endocrinologists who didn't know what to do. GLP-1s and those kind of medications didn't exist yet. So pretty much all we had were the bariatric or the diabetic medications like Actos. So they were like, well, we'll just wait for you to become diabetic and then we'll treat you. And I didn't think that that was our best route. And so I ended up at Mayo Clinic Jacksonville, and I just happened to have a resident before I saw the endocrinologist there who was like, hey, they're doing some studies about this at Cleveland Clinic. And have you considered bariatric surgery? And I thought, oh, well, no. Am I a candidate for that? And she's like, maybe.
Mm.
Maybe we'll send you, to the bariatric clinic and they can give you some more information. And so I ended up over at the bariatric clinic. Dr. Bowers is the surgeon over there, though Dr. Lynch is our bariatric PCP, who I now see kind of ongoing and saw at the time. And they thought, well, we don't really have any other good option for you. So, why don't we try this? And so I went through, at the time, my insurance required a year program that we had.
Whoa,
Yeah.
wait. Hold up. Hang
Yeah.
on. I want to talk about that. But first, I was wondering, what was the reason you were on metformin? For prediabetes or for
Yeah.
weight loss
So
specifically?
Uh, when I was 12, I just kind of blew up size wise and I gained a bunch of weight and no one could kind of figure out why. PCOS wasn't quite a known thing back then yet,
Sure.
even though I had a pretty progressive endocrinologist at the time in Chicago at the University of Chicago. We still didn't have any treatment options. And so he was kind of at the forefront of maybe using a little metformin to see if that would help. And so I was on that want to say for maybe like 5 or 6 years before
Okay.
I had that anaphylactic reaction to it. And so that was keeping
Oh,
my diabetes at bay. So I wasn't diabetic yet, but I had a PCOS doctor in Jacksonville who had ran my insulin numbers and which were through the roof, very concerning. He's like, I don't know how your pancreas is still
wow.
alive. I believe you
Wow.
will become an insulin dependent diabetic when you do. And so this is pretty urgent that we get on top of this and we deal with that. And he discharged me because my numbers were so bad, sent me to his personal endocrinologist, who was the one who was kind of like, there's nothing we can do for you. And that's what kind of set off
Wow.
this
How old were you
series
at
of.
that time?
I was in my early 20s because
Okay.
it took a while to actually find my way to the Mayo Clinic. I think I was, let's do some math here. I think I was 26,
Okay.
70. Yeah, I was 26 when I actually had surgery. So, and I had a year before. So I was 25, 24, 25 once I finally got into clinic at Mayo Clinic. And
Oh,
that was
wow.
a weird thing for them because they didn't do surgery on people that young. And even my surgeon was like, I don't really know what will happen to you. He's like, I don't do surgery on 20 something year olds. And I was like, oh, okay. This was obviously many, many moons ago. Now we
Right,
certainly do.
right.
But at the time, I was pretty young for surgery, and they didn't really know my outcomes. Their hope was my outcome would be better, because I was young and I wasn't yet diabetic, and so they were.
Right.
Dr. Lynch, the bariatric PCP, was pretty excited. He felt that we were kind
I
of getting
bet.
in ahead of the curve. How we utilize it now, but that was not a thing back then. He felt that we could get ahead of it, avoid the diabetes altogether, which we did.
Nice.
Then my body would be at a better chance of positive weight loss post surgery, keeping some of the health concerns away, and really using it preventatively, which is how we see it now, but wasn't how we saw it then. Really, it was still in that last ditch effort mindset of bariatric surgery should only be used as a last ditch effort after you become diabetic, after you have high blood pressure, after you're having
Yeah.
lots of concerns. So we were a little at the forefront of using bariatric surgery as a preventative. And that's how I found myself there.
Okay, so 2 questions spring to my mind. 12 years ago, lap band was
Yep.
still pretty prevalent,
So Mayo
correct?
Clinic was no longer doing lap band at that time, which
Okay.
was interesting because one of probably the most prolific lap banders, surgeons, was in Jacksonville at the time. He still
Oh,
does lap
wow.
band to this day.
Okay.
So I originally had thought, because at the time that the popularity was more with lap band, but the surgeon at the time had told me, we're not doing those, and for your specific issue, since we're concerned about diabetes, we think that
Ladies,
bypass would be your best option. Sleeve
for
was
sure.
not being utilized the way it is now. 12 years ago, we were only utilizing it in the super morbidly obese, who it was going to be a precursor for another surgery. So
Correct.
sleeve was not offered. So at that time, my surgeon, in my case, was only going to do gastric bypass,
Very good.
which would be the decision I would make today if I had it again. So we
Okay.
wanted
So
to
tell me
intervene
about
as
this 1 year
yeah,
pre-op, which I mean, I know patients would lose their mind about that, but I
yeah,
I love the idea personally, depending on what the pre-op process was.
right. So my insurance at the time, I was a state of Florida employee. I worked for the health department, and so their requirement at the time was a 1 year post-op program where you checked in monthly for a year. So I saw the bariatric surgeon, I saw the nutritionist every
Hmm,
month for a year, and I saw the psychologist a few times, who was wonderful. And she was
awesome.
not, interestingly though, at that time, she was not part of the pre-op program other than the eval. So we just saw her once, and then I
Really?
requested to see her once or twice thereafter. Yeah, very interesting.
Okay.
At that time, that was not part of the pre-op program. It was just nutrition and doctors. So we did a weigh in. Honestly, I really felt like it was kind of box checky. I did not get,
Mhm.
additional
Yeah.
information from it. I felt very well supported by my program, but at that point,
Yeah.
I was kind of racing the clock to not become diabetic. So I really saw that as a hindrance to me being
Yes,
able to get
I
surgery.
know.
But we were able, I was able to maintain my weight. I lost a little weight prior to surgery. And at the very least, I didn't become diabetic in that time. We did
Right.
try to request, like make a special request, but it was just an aspect of, at that time,
Interesting. When I
qualification.
started when I started, it was like 20 years ago, and the program that I originally started with, they were trying to kind of, franchise their pre-surgery process, which honestly was amazing. So I think it was like 6 months, and they required all of this stuff, the dietitian, group classes, they met with the surgeon, but they also met with the psychologist
Mm,
every week for 6
yeah.
months as a group, not individually, and
Mhm.
his background was in, addiction and recovery. because and this is where I come from, knew that, like people who were going into treatment for some kind of addiction, knew that people having bariatric surgery, many of them were going to need a lot of support afterwards. Because for a lot of people, not for everybody, obviously, but for a percentage of the people who have weight loss surgery, food is kind of a friend. Food
Mhm.
is an emotional calming, substance. And so without learning new skills to deal with life stress, and not being able to use food to comfort themselves afterward, they were going to need some additional skills like healthy communication skills, like learning to set boundaries, like learning to, increase their self-esteem and their value and all of those things. So I was so excited by that because I thought, this is preparing patients in all of the realms. Well, then it wasn't long before there were programs on, popping up everywhere. And this
Mhm.
program required a $500 program fee. And the
Mhm.
ones popping up on every corner did not. Therefore, people were going to those other programs. So they could no longer afford to do that. But
Yeah.
it's kind of a bummer because the
Yeah.
training was so amazing for the patients preoperatively.
It's interesting too because I think regardless of kind of how we find ourselves here, the support aspect is really important. And it's
Mhm.
interesting because I kind of needed the opposite support. I needed to be able to go back and learn that food was okay. Like I'd been on such restrictive dieting
Oh,
to
sure.
try to deal with the PCOS, and like the restrictive dieting that I did prior to surgery is far more restrictive than what I eat now. But it
I'll
took a
bet.
lot to get out of that mode of like getting out of the food is fuel mode, which is really where I found long-term success. Is food is not fuel. Food can be a normal part of my life. I don't need to be so restrictive. And it took a long
Right.
time for me to actually get out of that diet mindset and actually have long-term success from it not being a diet and more of lifetime eating. And it's
Mhm.
interesting because it took a bit of work even for me to kind of get out of that. And I had a lot of support from the bariatric program I was with. It was
That's
a
awesome.
program that integrated carbs very early on, which felt very foreign to me.
I'll
I
bet.
had been on low carb for 10 years. So it was
So
very weird when my program was like, no, we eat carbs in stage one, stage two. Like carbs are integrated very early
sure.
on
Yeah, your
for
brain
energy.
needs carbs.
Yeah.
We need
And
it. Yeah, absolutely. And absolutely, food clearly is fuel, but it's a whole lot more than that. It's part of our culture, it's part of our lives. And so we want to have a healthy spectrum in terms of our attitude toward food. So you went through the program, you had the surgery, and how was your healing? How did
great.
things
I really had no, I was a pretty cut and dry. I had no, now my surgeon also was doing it closed,
nice,
laparoscopically.
nice.
I'm not so far back that I am done open or that I was done not laparoscopically. So we were still at kind of the forefront of things, but I still had the
Sure.
surgery laparoscopically. I stayed in the hospital for 1 day, though it was normal for his
Nice.
patients to stay 3. Again, I was young. I woke right
Oh,
up.
sure.
I walked immediately. I can't take opiate pain medication at all. So I had requested none of that if possible, and we were able to do the surgery without it. So I woke up really well, and so I was up
Beautiful.
walking, and I was told, walk, walk, walk. And I couldn't sleep. I have a weird reaction to anesthesia where once I'm up, I then don't sleep well. I have kind of opposite. There's a lot of things I get opposite reactions from. So I was
Mhm.
up and I was gonna be up, so I remember I told the nurse, "If you can show me how to disconnect everything so I can walk, I won't bother you." And she was like, "That sounds wonderful," because I just wanted to be up and walking. So I would take a lap, come back, sit down, drink some water, get up, take a lap. So they were like, "This one needs to wait.
Win-win.
She's fine."
Win-win.
So I
Very
went
good.
home, and we didn't have any apps or anything back then, so I had a big journal, and I had, 15-minute water, water, I drank water.
For
I
sure.
didn't have some of the weird things people have with water post-surgery. I remember I got in the car, I accidentally chugged a bottle of water because I just needed
Holy
a lot of
moly.
fluids, and I remember I sat there and I'm like, "Something bad is gonna happen now." My husband's like, "Why?" And I said, "Because you're not supposed to be able to do that." So we just sat there for a minute in the car, and I was like he's like, "Are you okay?" And I was like, yeah, I guess I'm good. So I didn't have any of kind of the restriction around fluid intake post-op.
Mm.
Great. I was
Well, then you didn't
almost
get dehydrated.
no. So I was most that was actually one of my biggest concerns. So I naturally drink about a gallon of water a day. And I
Mhm.
was very worried that I wouldn't be able to intake. I don't sweat,
Oh,
which is kind of
good.
weird. So I
Oh,
get dehydrated really quickly if I can't drink that much
interesting.
fluid. Um,
Sure.
so my biggest worry was dehydration post-surgery. I didn't really have
Absolutely.
much. I preemptively there was like an IV clinic that I had made an appointment. I was like, I just want to make sure. And they came in, they're like, Ashlyn, you're like really hydrated. I was like, okay, okay. I just want to make sure. They're like, we'll give you some, but I think you're fine. And I was like, okay. Because I was really on top of that. I was very worried. I had dehydration issues prior to surgery
Okay.
because of that weird thing that I
Mm,
don't sweat. So
very good.
but I did well with that, and I didn't have a lot of food intolerances. I was able to eat pretty much post surgery. Now, back in the day, we used to progress you really quickly, so like by a week out, you're eating solid foods. So a very
Seriously?
different, yeah, very different post operative experience than a lot of my clients today, where you progress very slowly and you don't have solids for
Exactly.
about a month at least. Yeah, when we left the hospital, we were on mashed, and then you had a couple days, and then you were on solids pretty quickly, which is
Mm,
interesting. Early 2000s, we didn't. Yeah, I remember I had a friend who had surgery, and there was no diet. There was just eat what you could tolerate. And I remember
oh
she ate a
my
grape.
goodness.
Like day 4, she ate a grape and threw it right back up. And I remember thinking, I wonder why she did that. That's healthy. We thought she should just eat healthy
Sure.
stuff. Looking
Yeah.
back now on my own journey, I'm like, oh my God, I couldn't have grapes because the skin of the grape, I couldn't have grapes for a while.
I'll
So
bet.
yeah, so raw fruits and vegetables, I think were one of the last things I could tolerate. But no, I had pretty positive. I lost weight really quickly.
Good.
My body really was one of those light switch once we fixed um, the situation with the insulin resistance, the weight just fell off, and I've maintained.
Good.
So I've had obviously ups and downs. The pandemic wasn't good to me, like most people, but I think that overall, I had a very positive experience with bariatric surgery. I never
Good.
did become diabetic. Most my PCOS
Beautiful.
resolved. Most of my health concerns have resolved. So I do have a little bit of hypoglycemia if I eat certain things that I have to keep on top of. But other than that, post op, I get dumping if I eat the wrong foods. And
Mhm.
so occasionally I still get that. But otherwise, I did not have any major complications or anything post bariatric. So I was pretty.
This is one of the things that you can educate me and the listeners about because I know that with the gastric bypass, it's roughly 40% of people actually experience dumping,
Mhm.
but everybody thinks they're going to, and so I know that, you know, you can prevent dumping, right? People are like, "Oh, I don't wanna have that bypass because of that dumping." I'm like, "Well, you can
Right.
prevent it
Yeah.
by not eating certain kinds of foods." But what is the reality of dumping with some of the other procedures?
Yeah, so for me, dumping is really a specific situation. I almost always it is a larger meal, and then I push this desserts afterwards. And what I figured out throughout the years, it also couples with constipation, which I didn't really understand
Mm,
that connection for me either. Because I'm like, sometimes I can have a bigger meal and dessert, and I have no issue. What is the theme here that I'm missing? And so, very common post bariatric constipation, definitely an issue I've dealt with, which is ironic because I had IBS-D going into surgery.
wow.
Had never experienced constipation a day in my life, had quite the opposite issue. And post bariatric constipation is something that I manage. But if I am going into, it's almost always a restaurant. So it is usually a restaurant meal. I don't 100% know what is the contents of. So it's probably a
Right.
richer meal that I am not 100% where, maybe I'm having more fat than I realize because of how restaurant
Mhm.
meals are usually prepared. And then I am
Right.
pushing dessert just a smidge too far. And usually it's just a bite or two extra than I should. And
Right.
then for me, dumping mainly looks like dry heaving. I can't actually throw up post op. That's been a weird
Mm,
thing post
hmm,
bariatric for me. I don't throw up. I get really sweaty, really clammy. I feel very disoriented, and then it passes. Usually takes about a half hour. of uncomfortableness, and sometimes I get it, sometimes I don't. So
Right,
it can
right,
be a little random for me, but it's very rare. If again, now that I know what causes it, I usually don't get it, and maybe once a year.
right. And
Again,
that's
now that I know what it is, I
yeah,
can avoid it.
and it's important for people to understand
Yeah.
that, some people think, "Oh, I'm so glad I'm gonna get that dumping because it'll keep me from eating sugar." I'm like, well,
Yeah.
first of all, you need to understand that not everybody gets it. In fact, only about 40% of people do, so don't count that
Right.
as the thing that's
And
gonna prevent
knowing
you from
and
certain things.
doing, just like an addiction, doesn't matter. We know we
Absolutely,
shouldn't smoke, people still smoke. So that knowing and
absolutely,
doing, 2 different
abs I agree. People always say, "When you know better, you do better." I'm like, "Really?
things.
Because
Yeah.
how long have you known such and such?"
Right.
Yeah. So
Still
with
happens.
let's say somebody has the sleeve, there's less dumping than with the
Correct.
bypass, but it can
However,
still happen.
it can still happen. So sometimes people will say, "Oh, I'm going to get sleep so I don't get dumping syndrome," and I say, "Oh,
Right.
time out." Like if that's your expectation, it's
Mhm.
less common, but can happen, and then more common with SADI and duodenal switch. Duodenal switch tends to be a little more sensitive to fat. Though they can get
Mhm.
dumping from sugar, though I see more with my clients, it's more has to do with fat and is more on the diarrhea side of things than vomiting.
Correct.
And Saudi, I see kind of both, where sugar or high fat doesn't tend to bother me. It has more to do with sugar content, but I have clients that go both ways with bypass. Saudi and duodenal switch tend to be more on the fat side that causes
Right.
dumping.
Right. Okay. So glad we cleared that up. So
Yes,
were you finished with school with your formal education with your
yes, yes.
LCSW by the time you had surgery?
I was. So I was fully
Mhm.
licensed. I worked for the health department. But I didn't know if I wanted to be a therapist yet, even. I
Right.
was still
Well,
thinking I was
okay.
going to be a social worker,
Okay.
working more in the trenches of social work and advocacy. I worked family planning at the time, high risk pregnancies,
Wow.
and getting more information out to lower socioeconomical, getting rid of myths surrounding family planning and
Wow.
so helping women make better choices surrounding family planning. So I thought I'd be more in the trenches. I didn't really see myself as a private practice therapist. But as I find in my life, if I say I'm not going to do it, that's usually where I end up. So
Exactly.
here we
Never say
are.
never, Ashlyn.
Never say never because that's usually what you're going to do. And so I did some agency work after that. I briefly worked in medical social work. I didn't really like that.
Mm,
And then ended up figuring out, oh, like I really do like one on one therapy. And then I said, oh, I'll never have a group practice. I'll never train therapists because what do I know about therapy? So it's funny.
yeah.
Again, I said I never do that. Now I do that. So yeah. So now I have a focus on training therapists to increase the amount of bariatric therapists that we have, and I have a group practice where we see clients and I see clients full time there as well. So it's interesting when for a lot of therapists they end up working in things with clients that they know that look like them. Not
For sure.
always, but it is kind of funny. You'll for some of us we find ourselves there, and it makes
Mhm.
sense. I think now, especially as far out as I am, that I find that the more that I work in it, it makes sense that's where I ended up. Because it took me a while to figure my stuff out too with the
Well,
bariatrics.
sure.
Yeah.
So what I'm hearing you say, as the therapists
Yeah.
say, you did your own therapy.
Yeah. And I ran into some really crappy bariatric therapists along the way, which is actually part of how I ended up in doing bariatric therapy myself. I saw one like when I was preparing for therapy outside of outside of my bariatric practice, and she was like, "Well, you're going to become an alcoholic, so cut out that alcohol and leave your I think we were engaged. Leave your fiance because you're going to get a divorce. He's going to leave you anyways." And I was like, "Well,
Wow.
yeah, I'm like, I remember I came home from that session and I was like, well, I guess if there ever was an example of how not to do therapy, that
That's a
felt like
little
it.
horrifying. I've heard stories like that too, like anybody who's experienced well, not for this particular therapist, what they would do when anybody had any kind of sexual abuse history, they would say, well, you're just going to go out there and start sleeping with everybody. It's like, you cannot generalize patients like that. And what a horrible what kind of therapy? That is not therapy aim at all.
Yeah. And
So how
a
did you,
little too direct for me too.
yeah, yeah. It's not my job to tell people what is going to happen. I'm not a mind reader, nor am I
And it's interesting
nor,
because alcohol, I wasn't a big drinker before. I'm not a drinker now. Alcohol didn't change like my feelings on it or my use of it didn't change. And
right.
it is a risk factor. You know, people
For
certainly
sure.
struggle with alcohol post surgery. But it was kind of funny because I remember thinking like, I'm not a big drinker now. That would be quite a big change. That would be a big for me. That would have been a very big change.
Absolutely.
And in my head, I'm like, I think I'd notice that because it's such a different. It would be such a difference for me. And
Sure.
it's interesting because my husband, who's my husband now, was either I was dating him or we were engaged, I think, at that point. We've been together like 8 years at that point. So I'm like, I'm not getting a personality transplant. I'm just gonna, be in a smaller
Right.
body. So I don't know, and it's interesting because people often will ask me, is the divorce rate higher amongst bariatric? In research, we actually don't find that it's higher than the general population, only because the general population already has a really high divorce rate.
For
So
sure.
when we look at when we control for the actual divorce rate of the general population, we actually don't see a higher. It feels like it because we definitely have people around us who've had bariatric
For
surgery
sure.
and gotten divorced, but that's also the general population too. So. Um,
Absolutely.
but it was interesting because I came home, I told my at the fiance at the time, or my husband now, and I was like, "Do you think that bariatric surgery would impact us being, getting married or being together?" He was like, "Well, I don't know." Um,
Did
so we'll
it?
figure it out.
I mean, it did impact you being
Yeah.
together, but were there changes in your relationship?
I think for us, not in the way that I think people would expect. I mean, I definitely historically am a people pleaser and make things easy for people. That's just kind of who I am. And though that's changed to some degree, it's not in the ways that I think people would think in a marriage. No, I think I was able to I think it's because more my husband than me, if I'm going to be totally honest. My husband
Okay.
is probably one of the most emotionally intelligent people in my life, despite him not being a therapist and me being the therapist. People are always like, "Oh, you probably are the one that can express their emotions." I was like, "Nope, that's him." So I think if there was ever a concern, he's definitely one to just say like, "Hey, let's talk about this," or "I
Okay.
noticed
That
this," or
helps.
it does. So we had a pretty healthy relationship going into it, which ironically, this is kind of funny too. We met on eHarmony in the days where they actually did the testing and like figured
Oh
out
my
who
gosh.
who was compatible from the psychological
That's
testing that they did.
wild.
And the funny thing is they are 100% for us was right. Like what I was looking for and what I needed were very different. And it's
Yes.
funny because back
Yes.
then, you couldn't even look at matches that weren't in your compatible zone. So, like, if
Oh,
someone was not in the compatible zone, you couldn't look at them. That is kind of the beginning
oh
days
my
of eHarmony.
gosh.
Isn't that funny?
Wow.
So I
That
wasn't looking for emotionally intelligent men, but eHarmony knew I needed that. So
that's awesome.
it's just funny because it is now like
It is funny.
17, 18 years ago. But, you know,
So he
that
didn't
I think had
react.
more to do with how we
Yeah.
didn't end up divorced than the surgery or not, or
Okay. So he didn't react to like, oh my gosh, he didn't get insecure about your relationship.
no, it's funny because I guess part of me was worried about that, like, if I changed drastically, thankfully, our relationship or attractions are not based on larger body size. So I do when I work with clients, if their partner, part of the attraction is they really like to date or sexually attracted to larger bodies, and you're about to transform potentially not
Right.
into a larger body. That was not our dynamic. So thankfully, that wasn't an issue as I was in a
Mm-hmm.
smaller body. Um, I think I also appreciated that with him, like, as I
For sure.
changed, he'll always tease, he got the prize. He's been with me since I was in a very different body size, and so I think that we really viewed that as like we're going to be on a journey. Are we both up for it? Or are we both on board? Because things, I've had skin removal, and I think that's been more challenging for him from a sense of seeing me in pain or seeing me kind
Right.
of going through surgeries,
Hmm.
than the actual, like, his concern about what I'm gonna look like, or anything like that. I think more for
Right.
him, even when I've had other medical issues, the concern always is like seeing me in pain. And I have a super
Oh,
high pain
sure.
tolerance.
Mm.
Because
Fortunate since you can't take that medication.
yeah, yeah, yeah. Since I can't take any of the opiate. It's funny. I had
Right.
in case there's any listener who's in the same boat. Um, I always was curious about why I can't take any of the opiates. They make me like deathly ill. And there's a genetic test that you can take. And my doctor was like, "Hey, let's
Really?
run this and figure out which one you can take." Because ultimately the issue is that I am missing an enzyme in my liver that breaks down certain opiate, most all opiates. Actually, I can't take literally the test told me I couldn't take anything. I'm missing that enzyme. And so when the
Interesting.
medication gets into my body, my liver cannot clear it, and it creates toxicity levels, which is why I feel so terrible when I take it.
Sure.
And it doesn't work, which is
Mm.
even weirder. It doesn't
Yeah.
provide me pain relief because the little receptor, I guess, can't get up to my brain. I don't know. So if you're someone who can't take opiates, it may be
That's
because you're
interesting.
missing a. The good news is because of that, and I've had to be through some pain. My pain tolerance is pretty high, so I've been able to have skin removal surgeries without opiate-based pain medication,
Wow.
just Tylenol, muscle relaxers, those kind of things, and that's been helpful so that I don't have that potential addiction risk, and that kind of thing. It
Right.
definitely wouldn't be something I'd be addicted to.
This is a tangent, but I'm wondering if they can test to see what antibiotics you can take because I keep having reactions to antibiotics.
I know on the test that I took, it's for mental health meds, heart no,
Wow.
cholesterol, I think cholesterol, and then opiates at the time, and then I took it maybe
Right.
10 years ago.
That's
So, they're
interesting.
probably better now, but it has to do with pathways in your liver. Super fascinating. My entire family has this issue, and I'm also super sensitive to garlic, which is related,
Isn't
which is
that
weird.
fascinating?
Yeah, so
Wow.
garlic, aged cheeses, red wines all have an enzyme, that your body has to break down. Mine can't do it very well, and so
That
I have
is
a hard time with
fascinating.
those. But if you cook garlic, I it makes it less. It still makes me a little sick, but not. The only time I've had hives, oh my god, this Vietnamese restaurant, I love it. They have this one dish that has a hot pan, and they put 40 cloves of garlic and then whatever, and it makes a
Oh.
boom of garlic smoke. They did that right next to my table one time, and I actually broke
Oh,
out in
no.
hives.
Oh, no.
That's
Oh
the
my
only
god.
time I've ever had a reaction like that. Most of the time, it just makes me a little sick. But
Oh my
but again, my
gosh.
whole family has that, and I think it has again to do with that like liver enzyme breakdown.
Interesting. Well, that's good. I'm glad.
So, yeah,
So,
if
yeah,
you've
if
ever
anybody
wondered that,
struggles with that,
listeners, yeah, if
for
you've ever
sure.
wondered what's going on, that's potentially what's going on. Um,
That's good info.
yeah,
Um,
yeah.
so did you just gradually transition to working in the bariatric
So,
world with
how did
the
that end up
therapy?
happening? I was at a group practice doing my thing, not seeing bariatric patients, and I actually wasn't open about having bariatric surgery for about
Mm,
5 years in my journey because one, Instagram didn't exist. There was no real platform for
right,
me, one, to be like, hey, I've had bariatric surgery. My friends knew, my family knew, but there wasn't really platforms to talk about having bariatric surgery, but also it was still kind of seen as like an extreme measure at the time.
sure,
And I don't think people understood because they didn't see me at 4, 5, 600 pounds. They didn't really see they didn't see the medical aspect of it. That at the time
right,
it was really supposed to be used as a last ditch effort for the super morbidly obese. And so I was out of kind of the norm of what people thought of for bariatric surgery. And so just to
sure,
be easy about it, but my
right.
boss at the time knew that I had had bariatric surgery, and someone had called and said they needed to have an evaluation. And I explained to her, I said, "Oh, no, we can't do those. I think only psychologists can do them, and their center probably needs to help them." And the client called back and they're like, "No, the doctor said I can have it done by an LCSW." And I was like, "I don't think that's right." So I called the insurance, and the insurance was like, nope, you can do it. And I was like, well, that's interesting. And the surgeon had sent me like some information. And like many of us in therapy sometimes do, we'll do stuff before we know if we're actually able to do stuff.
Right.
So I did
Right.
an eval, not
Sure.
really knowing if I should or shouldn't do an eval, but I followed the
Mhm.
guidelines. The surgeon's like, no,
Right.
this looks great. I created my own letter. I created a format for it. And then I sought out and I was like, I'm going to get me some training. Except it didn't
And where did
exist.
you find that? Where did you
I
find that?
didn't.
Yeah, I was gonna
I
say, where
didn't.
did you find that
I
training?
I didn't.
Yeah.
I did not find that. That would have been, gosh, 7, 8, 9 years ago. No,
Mhm.
12. No. It was 5. So 8 years ago. There was none. So I said, okay, well, I'll do. So I watched some videos by the ASMBS about how to educate
Right.
people about the cert. So I made up my
Right.
own little program, and I didn't tell anyone I was doing it because I assumed I'd get yelled at, right? So
Yeah,
if someone called, we didn't advertise, but if someone called, and then I was able to actually negotiate a higher rate with the
for
the
sure.
the person I was working for, and I was like,
Right.
okay, well, this is good. So I just did it that way for a little while, and then I got a new job where I was a clinical director of this little nonprofit. And part of my job was to bring more income in so that we could keep the nonprofit afloat. And so that's
Sure.
where I started doing more of the
Ah,
evals as actually a means to keep the non. So I didn't actually make
very cool.
money off of that. And then that I was able, it's so funny too. I was sitting at a baby shower with my husband's coworker, and
Okay.
his wife was the coordinator of one of our local bariatric surgeons. And she's like,
Uh-uh.
your husband told me that you had bariatric. I said, oh yeah, I'm a therapist. And, I do the evals if you ever need it. I don't advertise or anything, but she's like, you do, we only have this one lady and she doesn't take insurance. And we have to wait a long time. And I was like, well, I could come talk to the office. I had no idea this was like our biggest office in our area.
Right in the area.
So she invited me and I had a meeting with them, and they were like, can we see what your letter? And they were like, oh my gosh, this looks so perfect. You should teach other people. And I said,
Right.
no. I don't do that. And so I just continued on that level. I just had that one office. And then our it's interesting. Orlando's an interesting place for bariatrics. We have like 2, 3 main offices for years. Then we had an explosion. Now we have like 12. So we
Is
literally
that
have,
right?
yeah, we
And
literally
the
have 12.
community can support that many.
Yeah. Yeah. Yeah, no, we have quite a few bariatric surgeons now. And so now I work in almost all the offices. There's 1 or 2 that have internal evaluators. But so
Right.
I did just evals by myself for a while, and then I took a little break because I was like, "Oh, I don't know if I want to do these." And then I went back. Another office came in. They're like, "We need your help. Please come back." I got more efficient with them. That really helped. So I created better
Right.
templates. And then
Right.
during the pandemic, I had a lot of people ask me to teach them, and so I would teach them
Mm,
one-on-one how to do these
okay.
evals. And then
Very
during the
cool.
pandemic, as we got more used to Zoom, a friend of mine was like, you should just tape this and you could sell it as a training. And I was
Oh,
like,
great.
oh. And so I did that. And then I've expanded.
Smart.
So how the Find a Bariatric Therapist came about was that I was trying to build the like people to other therapists to find the training, and the business coach I was working with at the time was like, you should go on podcasts. And I was like, oh, I don't think I should do that. I don't want to, like, that's national, that's like permit, I don't know about. She's like, yeah. So she's like, just reach out. She's like, do some bariatric ones first just to get used to it. So I Googled like biggest, or I just put
Yeah.
bariatric podcast, and I
Right.
cold messaged a bunch of people.
Oh my gosh, I
Yeah,
love that. That was very
that's
courageous.
oh yeah, I was like terrified. And they all got back to me and were like, we would love you. I was like, oh God, you would? What do you want me to
Yeah.
talk
I
about? And
remember you telling me how not out there and
yeah,
how anxious you were about that.
yeah. I'd never done any, I've always been up until that point, and I think that's part of my weight journey too. Small. You're just a social worker, you just help these people, you just do
Mm,
this, you stay small, you stay over there, you just help people. Your job is to help people.
right.
You're not going to make any money, you're just going to
Ah,
be very relatable to all your clients, and You're not going to drive up in the Beamer with the nice like you're going to have your crappy old Toyota driving out to, hand out condoms to people. When I worked with them, I had this
So
little blue car.
you pigeonholed yourself.
Oh, 100%, 100%. But I always assumed that's who I would be. So I
Right.
think one of the things with bariatric surgery is it definitely like opened me up to the idea. And I remember even in, this wasn't that long ago when I was developing the training, I looked at the business coach I was working with and I was like, I'm not an expert. There are people who have been in this field for a really long. They are not going to be happy with me for selling this. And she looked at me and she goes, "Do you know how organized you are?" She's like, "Okay, if you can't deal with being an expert, then you know what you're selling? Education, templates, organization, scripting."
Right.
She's like, "Could you agree with that?" And I was like, "Oh yeah, I could agree with that."
The other thing is, those of us who have been in the field long, long time have had the opportunity to do that. And if that's where we wanted to go, that's where we would have gone. Right? So you're filling a need that none of us had the interest to do.
Yeah.
So
And
that's
it's funny
amazing.
because I never really thought that actually supervision and therapist training would really be the area. I love my clients. I love working with clients. But
For
when I
sure.
started as the clinical director, one of my roles as the clinical director at the nonprofit, um, was a supervised new therapist. And the funny part was the reason I do so well with that is because I was the terrified baby therapist who had no idea what I
Yeah.
was doing and assumed when I learned, it took me years to learn about imposter syndrome. I thought I was the only one who felt like that. I thought everyone got
Oh,
out of
yeah.
grad school and they're like, I know how to do therapy. No,
Oh,
we all get
gosh.
out of grad school. We're like, oh my God, they're going to ask
What
me
do I
questions and I'm going to
do?
have to tell. Yeah, what do I do? And
Exactly.
so I love working with new therapists to be like, so by the way,
Yeah.
you're probably going to have this imposter syndrome, and that's true in bariatrics too. And the funny thing, so I go and so I'm reaching out to all these podcasts, and Mel and Kelly were one of the ones, our Sleeve Life podcast, that reached out, and they're like, "We'd love to have you," and I was like, "Okay." I had listened to their podcast, but I had no idea their viewership is so huge. So
Right.
I'm not realizing I'm going on like one of the biggest podcasts. So I go on and
Absolutely.
do my thing, tell my story. And my inbox on my Instagram, my little tiny Instagram that
Oh,
I just kind of shared this and that, started getting, "Can you be my therapist? Can you be my therapist? I
oh,
think you
wow.
understand me. I need a therapist." And I was like, "Oh no. I can only be your therapist if you live in the state of Florida," which
Right.
none of them did. And I said,
Right.
"Don't worry." And so I would stay up and I would contact all these people I knew. I'm like, "Hey, can you take someone from the state of California? Do you know someone for the state?"
Oh,
Someone from England contacted me. I have no idea what to do, or not the state, the country of England. So
yes.
country of England, I have no idea what to do with that. I don't even know if we're allowed to see them. Like, what are the licensing?
Right.
So that is how, again, as I'm like, oh well, I guess I'll do this too. The I created the directory, and so I have a friend
Great.
who does a directory for supervisors, qualified supervisors. I asked her, I said, "Is that something you can just do?" And she was like, "Yeah, yeah, yeah." She's had it for a while, and she told me how she set it up. She's like, "If I do it again, though, I'd figure out some kind of better plugin." And I just Googled like Squarespace plugin. The plugin is just a program that helps your website look better. Is there one for directories? Lo and behold, there was, and it's really cheap. And so I
Wow.
can, do. So it was really easy. The hard part, as I later found, was that there's just not very many of us, and those that there
Right.
are, we're so busy, we really don't want to advertise on
It's
a
so
directory
true.
because we're full.
So true.
And then that's what moved me to kind of the piece that I'm working on now, which is business coaching for therapists. So I work with other therapists to add bariatrics to their practice. And
Right.
almost all of the therapists that I work with are bariatric patients themselves. They don't have to be, but usually that's what sparks interest and
Right.
wanting to work with the population. And I'm currently working on additional trainings for pre and post skills that therapists can learn to help clients better
That's
pre-op to
great.
post-op. So that's what I'm working on now. That's kind of the evolution of this, I guess. And who knows where it'll continue to go. And but that's how I founded the findabariatrictherapist.com. We do have quite a few therapists. I'm always surprised how many states, particularly with SIPAC, So the biggest issue for therapists is that our licenses are bound by the state in which we're licensed in. So I'm only
Right,
licensed in Florida, and really I'm so busy I cannot add another state. It would not be
right,
good for me. But
right.
SciPac for psychologists allow them to work in, I believe there's like 40 states now in
40
SciPac.
states currently, and several others are in the legislative process. So I can work with patients that are in all 40 of those
Yeah.
states. Now, the insurance issue is another ballgame. Unless I go and get signed up on insurance panels in their state, I cannot accept their insurance. So
Uh,
the states in which I am licensed and have been for several years, which is really just South Carolina and Georgia, I'm on those insurance panels, which takes
mhm.
quite a bit of time.
Oh, yes, me
So,
too.
yeah. So I can accept insurance from those 2 states as I'm on most of the panels. But if you're from another state, yes, I can
Oh,
do
no.
therapy with you, but it's there's no
Yeah, and
insurance
that's such
coverage.
a hard thing because it's so hard to find therapists, and I always like, I'll have clients that are really frustrated, and I totally get it. But it's tough because it's like I can't find someone that's in my state that takes my insurance, and I'm like, I've ran into that too personally. And I have a pretty
Mhm,
big insurance, policy, but
mhm.
it's particularly in Orlando, most therapists are cash based. And so
Is
that can
that
be a
right?
struggle. Hmm.
Well, that's great for the therapist, but what about
Right.
people who need to use insurance?
Yeah, so
That
one of the
that's
things
rough.
I take Medicaid and Medicare, and the Medicaid HMOs. I get a lot of calls every week from clients that are, I only see bariatric clients and first responders in my private practice, but it is tough because there aren't too many agencies left, and Florida has made it very challenging to take Medicaid as a private practice. There's like some weird legislation. We're trying to fix it, but
Mhm,
it's a weird, or Florida Blue, which is one of our biggest providers, gutted our payment many years ago, so a lot of people left. I stayed on, thank goodness, and when they gave our raises, was kind of handsomely rewarded for that loyalty, but a lot of people had left the panel, and so it
mhm.
left us, whoever was left. But it's tough, and I understand kind of both sides of the story, and why therapists
Sure.
do and don't. But I that is always, it's a little social worky part of me still. Access is an ethical issue, and I know not everyone feels that way, and
Sure.
that's okay.
Right,
And my opinions of that may change one day too, But for now,
right.
access is really important, and I think that
It is
particularly,
important. It's
yeah,
really critical. But if people go to find a bariatric therapist, they can look for somebody in their state and they can look to see if the person takes insurance and they can look
correct.
to see what their, out of pocket fees are and things like that, right? And they can see what their and I like on your site that you talk about, check the credentials, see if you think you're a good fit, see what kind of therapy the therapist uses, because you want to have a good fit with your therapist. And
Yep. And there's
the
all
good,
kinds. There are some therapists that are more direct. There are some that are
right,
less direct. There are some that
right,
use different types of therapy. And so it is okay if someone, I'm not everybody's therapist, and that's okay. And that's
absolutely.
okay.
Absolutely. So, yeah, sometimes you need to try one, and if the personalities don't match or the style of therapy doesn't match, then find somebody else. But it's a great resource that you're providing for patients and for therapists. And regardless of how a person loses weight, people don't understand necessarily that find a bariatric therapist doesn't necessarily mean bariatric surgery. Bariatrics means the study and working with the disease of obesity. So,
Yes.
regardless of how people are losing weight, you can go to find a bariatric therapist and find therapists who do work specifically in that field. But I'd
Agreed.
also like to say, that depending what issues you're working to address as a bariatric patient, not all you don't necessarily have to have
No.
a, a therapist who understands bariatrics. Now, if you're going to talk about, you know, how to eat as a bariatric patient and how to, deal with family members in the realm of your weight loss or theirs or whatever, yeah, you want somebody who understands bariatrics. But if you're realizing that, you need to work on your self-esteem, or you need to develop communication skills, or you need to develop, set boundaries, most therapists can help you with that.
Correct. Correct. And often, if someone comes to me and they're really struggling with an eating disorder, there are certain things that I want to refer out. And I always tell people it's not because I don't want to work with you. It's because I want you to get the best possible care. And I'm going to meet you on the other end of that. So I want you to get into some much higher
Absolutely.
level of care. Same thing, substance abuse, eating disorders. Even if they're bariatric connected, I may work alongside severe trauma
Absolutely.
situations. I have some great trauma referrals that I use, and I work in tandem with them. And it's, again, not
Exactly.
that I don't want to take care of you. I want the best care for you. I don't want you to try to deal with some of this stuff with me. And then I want you to see
Yes,
the best of the best that I've got available to me. And then I'm going to have you
exactly.
come see me after the fact,
Yeah.
or kind of as your long term. But yeah, especially also, like, if you're finding that your therapist is actually mean about bariatric, I have a lot of clients that will come to me after having very
Oh,
negative interactions with their therapist, about bariatric surgery. I've been in places
tragic.
where I've had a therapist yell at me and tell me I'm the reason their eating disorder practice is full because I'm passing all these people that shouldn't have bariatric. There's a lot of misnomers in even in the therapy world, that obesity is not an eating disorder. I think that kind of blows some of my peers' minds when I'm like, not every person who has obesity has the eating disorder. Like, they're like, really?
That's
You don't?
absolutely the truth.
Yeah.
Yes, yes, and
Yeah.
disordered eating does not equal eating disorder.
No, no.
Yeah, there are specific criteria.
Yep.
Yeah.
But
Here's
so I
my
was
latest
good.
here's my latest rant as a bariatric therapist, and I think that we as professionals need to educate other professionals in this field who aren't therapists, and the issue is body dysmorphic disorder.
Yeah.
So many patients are walking around saying, or doctors,
Yeah.
"Oh, apparently you've got body dysmorphic disorder." No, you don't. You
No.
have disordered body image. You
Yeah.
have,
Subclinical.
you have you have distorted body image. When you lose a lot of weight rapidly, you are definitely going to have a distorted body image. Your body, your brain and your body change at different rates. But people are running around saying they have body dysmorphic disorder,
Yeah.
and it is not that.
I have a 45-minute talk on YouTube. I think it's the only thing of mine on YouTube. It's called Body Dysphoria Post Bariatric Body. It literally, it's, don't worry, it's probably not body dysmorphic disorder. So I go through what
Absolutely.
it is clinically, and then I explain how
Good.
most of what you fear post bariatric is
Yes.
subclinical, which you still
Yes.
should get treated. It's just most
Right.
I very, very rarely, and I think it's really hard to, outside of therapy, how to know, like, when someone comes in and they tell me they think they have narcissism, and I'm like, okay,
Oh
well, the fact
gosh.
that you think you have narcissism, you can't. And they're like, well, how do you know that I don't have narcissism? And it's really
Mhm.
hard as a therapist sometimes to be like, because I know what it looks like. It's the
Yeah.
same thing with body dysphoria, but I always forget the actual. It's
Dysmorphic.
body dysmorphia. Yeah, that you know it when you see it as a therapist,
Yes.
and it is not what most people actually think. And I actually see more of
Yes.
it clinically outside of bariatrics, actually, than I do
Most
inside, like,
definitely.
at an
Most
actual
definitely.
clinical level. But all of us,
Yeah.
I always tell this great story. So when I had surgery, I got Torrid bucks, hot bucks in the mail. And I was so excited. I got my hot bucks. I drove all the way
What
to
is
Torrid.
that?
So
What is
it was,
that?
there were these dollars, they were like real women dollars for Lane Bryant. So if you bought enough stuff, you would get money, and then they'd send it to you a couple months
Okay.
later for the next season, and then it's like a big coupon.
Got
And this
it.
was like all year you'd save up for these hot bucks. So they came in the mail, and I had a lot of hot bucks. And I drove all the way. Now I am not in a size the Torrid sells anymore. Drove all the way into the Torrid, all the way to the mall, parked the car, went into the Torrid, started looking at things, and the woman looked at me and she goes, "Are you buying a gift for someone?" And
Oh,
I looked at her and I'm like, "What do you mean?" She's like, "We don't sell your." She's like, "Are you new to the United States?" I lived in a place that had a lot of people outside of the U.S. And I looked at her. I was like, "No, I got my hot bucks." And she just looked, and I was like, "Oh my god, I forgot. I'm not in." And again,
this
this
is
was before social media. We weren't looking at ourselves all the time in Zoom, so I
right.
really had forgotten,
Oh my
because
gosh.
I always tell my clients too, we don't walk around looking at ourselves. Our
Right.
body changes, but our view is this way. So it makes
Yes,
sense that I would forget that I don't shop there anymore. I can't.
that
But
is
my brain was so used to this
right.
excitement about getting the hot bucks, and I go, um, that the interesting thing as a therapist, I didn't put any meaning towards that. I just said, "Oh, that's a funny thing that happened, ha ha ha." And I went home, where I think sometimes for my clients, then that turns into the cycle. Well, there's something wrong with me. How can I not know what I look like? I can't believe that I would do that.
Right.
But that's not, again, that's still that subclinical. That's
Sure.
normal. We
Right.
expect that because
It's body, it's a distorted body image.
right,
And I have a whole podcast episode on body dysmorphic disorder. But for those who are listening right now and are confused, body dysmorphic disorder is a very serious clinical
yeah,
mental health issue. And it's when a person focuses on a perceived or real flaw, but it's one that most people aren't even aware of, but they're obsessed with, and it will really interfere with their daily life. And there's a high suicide rate with it. And so it's upsetting to me that people are going around saying, I think I have body dysmorphic disorder. And I have patients say, well, my primary care doctor says I probably have. No, it is not. It is
yeah, and
not.
it's that suicide risk, which is why it's so important. Because when we hear that, that go,
Right.
whoop,
We're get
that
alarmed.
puts up our
That's
alarm to
right.
be like, okay, well, how many hours a day are you able to go to work? What are you doing at work? And they're like, what are you
Exactly.
talking about? Like, that's all fine. And I'm like, oh, okay,
Like,
okay, so
you
it's
don't
not
have body dysmorphic
impacting.
disorder. Yeah,
Yeah, but it still causes you distress. Let's work on it. But I also
for
want you to
sure.
know that
For
if
sure.
what you're reading, like if you are running into things that say these clients are at higher risk for suicide, know that that's a whole nother
Yeah,
situation, and that is that's different than what's occurring here.
right.
Still
Absolutely.
distressing, but if you've ever had a
For sure.
therapist, it was a little more like, oh, really? Um,
Yeah,
that's why
exactly.
I had a client who was like, you sent me that suicide risk thing. Do you send that to? And I was like, well, yeah, I do send that to everyone. But since you had mentioned on the phone about that, and they were like, oh, I was like, yep, that puts you at higher risk.
That's awesome.
And debting addiction as well, or what people think is
Sure,
shopping addiction. Also,
sure.
that's another one. People will tell me, oh, I'm addicted to shopping, and I'm like, time
Yeah.
out.
Let's
Um,
check that. Yeah.
let's check that, because again, higher
Mhm,
suicide rate. Again, if you feel backed into a corner, and you're about to lose your
mhm.
house, or you've gotten yourself in too deep and you can't
Right,
see a way out. Where post bariatrics, of course, you're shopping a lot. Your size changes every couple weeks, so
right.
that's a very different
Yeah.
than a clinical,
And it's
dead.
so interesting because as therapists, we hear certain terminology that the general public throws around like, "I'm
Mhm.
addicted to whatever," and it's like, "Whoa, wait, what?"
Time
And
out,
it's
time
not
out.
really, right,
Yeah.
or, narcissism is a hot button
Yeah.
right now. Half the dang population is narcissistic according to the general public, right?
Dude, and it always cracks me up. I've had so many clients come in to be like, "I'm very concerned that I'm a narcissist," and I'm like,
Yes.
"You can't be if you tell me that. That's the
Yeah,
hallmark of narcissism. You don't acknowledge
right.
that it's a possibility." And they're like,
Exactly.
"Oh, okay, good, good."
Yeah. Yeah, so when we get a little like, "What did you just say? Can I check that out?"
Yeah,
That's why.
yeah,
Yeah.
especially around some of
So
the scarier stuff.
absolutely. So where can people find you? Where do you prefer that they find you?
Oh gosh, you can find me in all sorts of places. So on Instagram, my personal Instagram where I do meal prepping and bariatric adventures and what I eat in a day, 12 years post out, and problem solving from a clinical or a client standpoint. That is Ashlyn Change the number for life 2012.
Say
That's an
that again.
open
And it's
Ashlyn Ly.
ASHLYN.
Correct.
Yes.
Change the number for life 2012.
Love
And
it.
then my professional, like if you're looking for more like professional stuff about therapy, advance with no D, advanced bariatric counseling, find a bariatric therapist. Those are my two clinical facing. So those are going to have some clinical tips on there too. And then if you are a therapist that is looking for business coaching or you just want to learn more about bariatrics, bariatric therapy business coach is me, as well as learn bariatric assessments. That's also me. So I have many, many accounts. There's many ways for you to find me.
Right.
I am not
Yeah.
on Twitter. I'm not on, I have a very small, like I have similar ones on Facebook, but your main place where and I'm certainly not on TikTok. I'm too old. I can't do it. I can't do it. I can't do it. But I'm on Instagram. If you need help, if you're looking for a provider, if you are a provider, you're looking to like reach out to me. I'm a real human.
Excellent.
It's just me. So reach out to me if you have questions. If you're in the state of Florida and you do want therapy, I do have some spots from time to time. So if you are looking to seek therapy, I can see you in the state of Florida. Outside of the state of Florida, reach out to me. I'll help coordinate that care for you.
Good.
I have kind of a list that's kind of of not people on the list, but people I know that are
Right.
bariatric therapists
Right.
that can also help. But
And
that's
that's
how you find me.
so important. And if you're a patient looking for a bariatric therapist, go to findabariatrictherapist.com because I think it's a really wonderful resource for people.
Great,
So
great.
great. I love it. You're across the board, patients, professionals. And I love that you're doing that. Yeah, it was never, I was like, oh, no, that was never an interest to me. But I love that you're doing that because it's needed. It is so very, very needed.
Yeah,
Yeah.
it's interesting. There's a lot of people that have been in the practice for a long time that are probably moving towards retirement, and then there's some newer ones, and we don't have a lot of people in the middle. And so I do
Mm,
worry as start some of the generation that's been in it for a while as they start to retire, we're going to have kind of a hole, which is what I guess personally am trying to work on by encouraging other
good.
professionals to get in to this
Absolutely.
field so that we have more providers.
For sure. And thank you for the work that you do
Thank you.
and for the ways that you help both the patients and the professionals. So I will see you soon.
I know.
ASMBS right around the corner.
Yes.
Yep. Okay. So thank you all for joining us today. And all of Ashlyn's information, contacts, stuff will be in the show notes. So go ahead and look there. And Ashlyn, it's always a pleasure.
Yes, thank you so much for having
See
me.
you soon. All right. Bye bye.
Bye-bye.